Hello and welcome to this part of the Network Meta-Analysis course. I'm Harry Diantis. I'm the Head of Communications here at the Cochrane Collaboration. I'm going to talk a little bit about how to communicate your findings once you've completed your analysis. So to begin with, why communicate your work at all? Well, ultimately, it's so that people engage with it. That could be funders, policymakers, other researchers, medical professionals, affected groups. And ultimately, if you don't communicate your work, you can't expect any impact. So here you can see kind of a control review where there's been no communication versus a review for which there was communication. It tends to lead to kind of more people actually reading the review, because if you don't tell them about it, how are they going to find out? So to begin with, what is communication? I mean, ultimately, it could be anything where you're conveying information. So this is the manuscript itself, academic publications, any conversations you have, whether face-to-face, on the phone, direct correspondence over email, whatever it may be, presentations, press releases, social media. There's lots of different ways you can communicate your work. And the most appropriate form of communication is ultimately going to depend on what you're trying to achieve and who you need to reach in order to achieve it. So there are some key considerations you should think about first before you talk about communicating your work. To begin with, ask yourself, who cares about these results? Why should they care? And crucially, what do you want them to do once they've learnt the information? So put yourself in their shoes, and regardless of the audience or audiences you're targeting or the media you're trying to get to them through, you should always consider these key questions. Now, this is all going to start with your manuscript itself. So it's the primary piece of communication for any network meta-analysis, and any subsequent communication is going to be secondary. So it's really important to get the messaging right in the manuscript to start with. So the most read sections of Cochrane reviews certainly tend to be the abstract, in particular the author's conclusions. This needs to be generally accessible, a bit of a jack of all trades, can skew a little bit towards the academic. Now, the plain language summary, that should be as accessible as possible to the lay reader, potentially aimed at patients and carers if the review question is relevant to them. And really beware of jargon in this. And if the honest conclusion is you don't really know whether the thing that you're studying works or not, then be very clear about it in the plain language summary. You don't want to obfuscate using academic language. Then the implications for practice section, this will really depend on the review question. But this really should be aimed squarely at whoever you might expect to implement the findings. So that might be public health professionals, policymakers, health professionals, care home managers, frontline medical staff, specialists, prescribers, patients. Again, it will really depend on the review question. So, for example, if your network meta-analysis is a detailed comparison of surgical interventions, then it will probably be aimed at surgeons and upstream sources, such as guideline bodies who make recommendations to surgeons. Then the implications for research section, usually that's going to be aimed at researchers and or funders, depending on the implications. So, if your review has identified key research questions that need to be answered by future trials, for example, then the primary target audience is likely to be both funders who might issue calls for proposals to answer these questions, as well as researchers who may apply for said funding or respond to open calls. So whether it be used directly by funders or indirectly, for example, a researcher citing the review as evidence for why this trial is necessary, funders are very likely to be a key audience for this section. And then you should, in all cases, outline the key findings for each of these audiences as clearly as possible. And with network meta-analyses specifically, most people are going to be interested in the comparisons between the different approaches, since this is really the purpose and the strength of an NMA. Now I'm going to talk a little bit about knowing your audience and reaching them. So to begin with, who actually needs to know? You need to identify audience who might actually do something differently after reading the review. And do be realistic. Who are these decision makers? And if the findings have no consequence for a particular audience, then why would they need to know? And I would also flag that patients or service users are not necessarily a relevant audience for every review. And there's nothing wrong with that. For example, a comparison of different hospital staffing approaches is likely to be more relevant to service providers and managers than to patients, who would be unlikely to even have access to information to make decisions based on. So do think about who's actually going to be able to do something about these findings and who they're relevant to. And then ultimately, what are you trying to achieve by informing them? And then, where are they? So where can you find these audiences? Once you've identified relevant audiences, think about the best ways to actually get them. Any piece of communication should be tailored towards the audience that you are trying to reach. And so, again, you may be reaching them through direct correspondence. For example, if it's a policymaker in a specific area, you might just have a direct relationship with them. It might be at professional conferences, whether they be academic or policy type conferences. It could be through professional body. So, for example, going back to the surgeons example, it may be a professional association for surgeons that has a newsletter, and perhaps that's the best way to do it. Could be through specialist media, social media, or indeed mainstream media, again, depending on the audience. So I'm going to talk a little bit now specifically about media, so working with the media. So to begin with, why bother at all? Well, it's an opportunity to reach millions of people, can stimulate and shape public debate, influence key decision makers, and also reach key audiences through sectoral trade press. Now, on the right here, you can see the comparisons of kind of monthly website visits of major news websites. These are the 5 largest news websites in the world in English-speaking news currently. And as you can see, they have hundreds of millions of visits per month, whereas academic journals such as the Cochrane Library and the Lancet have a small fraction of that. Now, it's a very different audience and it's not always relevant, but this just shows you the potential. And again, that you can't just assume that if you publish something in a journal that everyone will find it. Now, on to what makes a good news story. A good news story needs to be new and interesting. That's it. Simple as that. Now, obviously, defining interesting, we need to go back to the audience and whether it speaks to them and whether it's interesting to them. And what's new? This could be new data, analysis, insights, arguments, or developments. And in the case of an NMA, this is most likely to be kind of new comparative data between different interventions, diagnostics, or whatever it might be that you're comparing. And what's interesting? So, this comes down to the question of who cares. Is it relevant to the readers' lives? Will it affect them materially or emotionally? And again, this is all about identifying the audiences, the readers or viewers or whatever it may be that you are trying to target. And also, does it develop a major topical story? And if so, what does it bring and does it move the argument along? Is it surprising, exciting, or alarming? So some findings may be of more interest because there's been recent debate about them, for example, and may be a major story and moves the argument along. And now I'm going to talk a little bit about putting theory into practice with some worked examples of how we've communicated a couple of Cochrane reviews in the past. So Hospital at Home, this was a Cochrane review from 2024 that assessed the impact of hospital at home services on care provision. So for this is quite a technical question. It's not one that's going to be of great interest to every patient or people that aren't in a position to do anything about it. For this, we identified the key target audience as actually kind of hospital leaders, administrators, those that would actually be implementing said strategies. So we pitched this to the Health Service Journal as a comment piece, and the success of this communication was down to knowing the audience and what they're interested in. We knew that this review was going to be of most interest to and most impactful for the people responsible for actually implementing these initiatives. So we worked with one of the review authors to distill the review's findings into a comment piece with key messages aimed directly at healthcare leaders and decision makers. And that was then published in the Health Service Journal to reach that audience. Okay, and then this next example is actually a network meta-analysis itself, which was looking at antidepressants for adults with chronic pain. Now, the review authors here were very clear that the primary audiences we were trying to reach were the guideline setters, including in the UK, NICE, which is a body that kind of sets guidelines for what should be prescribed for what condition. Prescribing physicians themselves, anyone that might be prescribing these medications. And then the secondary audiences, we have patients and carers who might be prescribed these medications and researchers who might want to improve the evidence base. So we had a varied approach to reach these different people. So for the guideline setters, for example, we had direct correspondence between the authors and the relevant people at the guideline bodies to say, look, your guideline says this. We have found that actually, you should be recommending this one or not recommending this one so much. And that was direct correspondence, and that was the most effective way to actually reach that audience and engage in a dialogue about potentially changing guidelines off the back of the review. So again, do not underestimate the power of direct correspondence, particularly when it's something where you have a defined audience that you know exactly who you need to reach and what you need to tell them, and where it's a small number of people. But for this one, of course, you had a lot of broader audiences as well. So for this one, we had a lot of media coverage to kind of cover all these audiences. So we had, you can see there, a kind of a German pharmacy specialist website and also an English language pharmacy specialist website, kind of looking at giving this information to prescribers primarily. And then you can see the BBC and Guardian articles there, which are much broader and, of course, will reach a lot of audiences, including policymakers and prescribers. And actually, this was an additional desire from the author team, that we wanted to make sure that we were being very clear and public about the evidence base behind these treatments, again, to add additional pressure to go alongside the private correspondence with guideline setters to try to change the narrative and to ensure that practice is much more evidence-based. And of course, remember, you're not alone. You're not going to be doing all of this on your own. Generally speaking, you're going to be doing this with the support of communications professionals from various sources. So you might be able to get support from your institution. So a lot of universities will have a central communications team who may be able to help you. You might have departmental or group level communications staff in your institution. And finally, the journal or publisher that you're publishing the manuscript in may also be able to provide support depending on the capacity of the team. And I would recommend contacting communications teams at least a month ahead of publication. And in the context of Cochrane reviews specifically, I would recommend kind of contacting at the point that the copy editing begins, and that tends to give enough time for communications plans to be made. And finally, just a bit of a checklist before you approach your communications team. Just make sure you're clear on the following. So be really clear about what you want to achieve with this communication. Be really clear about exactly who you want to reach, why they should care, and also what you would like them to do with it. Give them a rough timescale. Again, you have to speak to the publisher about timescales, typically speaking. And also be clear about who's involved, who are the funders, who are the other co-authors, who needs to be involved. And just always be as clear and open as possible with your communications teams. Tell them what you want to achieve, and they can help you get there. Thank you.